Good afternoon or good morning, Dr. Sadiq.
Good afternoon, Angel. Is it afternoon or morning? It's afternoon here, actually.
Oh, okay. Sorry. Um, Hello, my name is Angel. May I know your name, my patient's name?
Okay, Angel. The patient's name is Omar.
Omar. Okay, nice to meet you, Omar.
He is pleased to meet you too. Can we share? He's pleased to meet you.
Okay. Um, may I know your age, Omar?
Omar is 14 years.
14. 14. Okay, great. Um, can I know like your current living situation?
Okay, he lives in a polygamous setting. He has 13 siblings and he goes to school. He lives with his parents.
Okay. Okay, perfect.
They live in a swampy area with stagnant water around.
Okay.
And he
Right.
doesn't sleep under mosquito nets.
Okay. Um, may I know what like the complaint is, what he's been feeling, what brings him here?
Okay, all right. He has been having fever for the past 5 days, then a 3 days history of abdominal pain and a headache.
Okay, fever for the past 5 days. Has it been ongoing or just comes and goes in those 5 days?
It comes and goes. Yeah, it's on and off.
Okay. Um, what about you said he has coughs, right?
He has abdominal pain and a headache.
Abdominal pain. Okay. How can you describe the abdominal pain, like from 1 through 10? How painful?
6.
A 6. Okay. Um, what about the headache? Is that also constant?
It comes and goes.
Comes and goes. Perfect. Um, when did this like the headaches start and um yeah, the headaches?
Yeah, 3 days back. They started the same time with the abdominal pain. Mind you,
Okay.
there is no abdominal distension, no diarrhea, no constipation, no nausea, and no vomiting for the abdominal pain. Also, there is no cough, there's no chest pain, no difficulty in breathing, nasal discharge, or nasal congestion. None of those.
Okay. Great. Um, may I know second.
Yeah, I remember I told you he doesn't sleep under mosquito nets, and he lives in a swampy area. The source of
Um,
drinking water is also not too clean drinking water. Hmm?
okay. Does he is there when he like lays down or anything, does he feel better? Does it make him feel better? Or like when he rests?
There's no change with posture.
No change?
No change with posture.
Okay.
So,
Do
Angel,
you
based on these symptoms, what do you think, or what do you feel? What do you
based on these? Okay.
suspect?
Yeah. Based on the fever,
Yeah,
the headaches,
yeah.
um, I do wait. Can I ask one more
Yeah,
question?
please go ahead. You can ask.
Okay.
Yeah, go ahead. Go ahead.
Has he like where does he use the restroom? Anything like that?
Come again.
Where does he use the restroom?
Please, please say again. Does he use
Okay.
the restroom? Was that
Oh,
what you said?
like where does he like use the like go to the restroom?
Oh, okay. No, his stool is normal. There's no diarrhea, no constipation, nothing. It's just normal. Visit restroom.
Oh, okay. Um, how is his like eating? Like does he eat? Has he been eating good?
Yeah, he has. He has been trying. He eats most carbohydrates, protein, and vegetable.
Okay. Well, based on the fever, think he has malaria.
Yeah, yeah. He can have malaria. Of course, he can have malaria. Considering the fact that he doesn't sleep under mosquito nets, he lives in a swampy area, and he probably doesn't wear long sleeve clothing. So that would be disposing to bites by mosquitoes. Okay, what else do you think he might have?
Okay. Um, ver,
Don't
okay.
you think typhoid fever is a thing?
Yes, I do think.
Yeah, yeah, he has abdominal pain. We should
Okay.
consider that too. Okay,
Okay, so
yeah,
he has
perfect.
typhoid.
Yeah, he might have typhoid and
Okay.
or malaria. So now we now want to go to the investigation to either confirm or refute the diagnosis that we think. Okay. All right. So we want to know which tests are we going to run to see if he truly has malaria or whether or not he has malaria or whether or not he has typhoid fever.
Okay.
Yeah.
Mm, second.
And it's usually a rapid diagnostic test for malaria.
Okay.
That's the quickest. Yeah, that's the quickest thing to do. Like, at least we can get that easily. An RDT, as it's called. Okay?
Okay. Yes.
That's it. And also for typhoid, it's a blood culture.
Blood culture. Yeah.
Both of which
Um,
are positive for individuals. Their RDT is positive for malaria, and the culture is positive for typhoid. So you
okay.
got that. It's actually
Yeah.
a malaria and typhoid, yeah.
Mm, perfect. Okay. So anemia, and typhoid.
Yeah, malaria and typhoid.
Okay. Okay. So we did a blood culture.
Yeah, we've done a blood culture. We've done. So
Okay.
now we are going to treatment. So which drugs are you going to give Omar to help him get better?
I will medicate.
Yeah, what medication are you going to give him to help him
Okay.
get better?
Um, I think we'll give him, is it, I don't know, antibiotic?
Yeah, you give antibiotics for the typhoid fever. Perfect. And
Okay.
then for the malaria, you give ACT.
For the malaria. Okay.
Yeah, it's
Um,
ACT.
is it
Yeah, you just said it. It's ACT. Yeah, you said
um,
ACT, right?
yeah. Yes,
Yeah, you
yes,
said
yes.
it. Yeah, you said antibiotics for typhoid and ACT for malaria. So that's it.
Okay. That's
Yeah,
it?
yeah, that's it.
Okay, perfect.
That's it.
Okay. That's great. So we got the diagnostics
Once we get the treatment, so now, what would you recommend him to do to prevent malaria?
to prevent malaria.
Yeah, or to prevent typhoid, whichever one.
Um, like,
Remember, I told you earlier, he doesn't sleep under mosquito nets, so you can recommend the use of mosquito nets for malaria.
oh,
Okay?
he
Yeah,
doesn't,
he
yeah,
yeah, he doesn't sleep under mosquito net, so you can recommend that for malaria, and then the use of long
yes.
sleeve clothing and bug repellents. That should help. Okay?
Okay.
Yeah, that should
So yeah,
help.
we're
And
gonna,
then
yes, yes.
for typhoid, it's usually personal hygiene, hand washing, environmental sanitation. And you should wash those vegetables well before consumption. And also you should
Oh,
consume clean
clean
water
water, yeah,
consumption.
filtering.
Yeah, that's
Yes,
it.
got it. Yeah.
Yeah, yeah. Okay, so any other thing you want to add?
No, there's nothing. No, on the diagnostics, I think we got it. We're
Okay,
gonna,
yeah, we
yeah.
got it. Yeah, awesome. Well done. Well done, Angel. Thank you very much for
Thank you.
doing this with us today. Yeah, that
Yeah.
was wonderful. All right,
Thank
so do have a wonderful day.
you. Have a great day, Omar.
Bye.
Thank
Bye
you,
too.
Doug.
Bye.
Bye.